My first exposure to medicine was probably in college. I had a couple injuries that required surgery. I was worried that the doctors wouldn't understand my sporting goals and they wouldn't really get that part of my life, but they did. And they got me back to my sports and they worked with me on kind of my rehab. And so that was my first encounter with medicine and what kind of guided me down this path. If you have a fracture or a sprain or a strain, most of those patients don't need surgery. And I've been trained to treat and heal them without surgery. And so that's kind of the goal of my practice. When I meet somebody that has an injury, the first step is figuring out what it is. An x-ray or two, sometimes an ultrasound will be helpful, and then determining what your rehab and that process will be. We have sports medicine providers scattered around central Minnesota as well, and athletic trainers in schools as far as 2 hours away. And so we really have a lot of specialists that are part of our network. I think we're really collaborative here at CentraCare and the University of Minnesota Physicians. We have a great sports medicine group of surgeons. We have foot and ankle specialists, trauma specialists. Athletes don't only have sports medicine problems. And so we'll see someone with chronic fatigue and they need to see a cardiologist. Or we take care of concussions here, and maybe it's a really complex concussion. They need help from a neurologic specialist. And so having those extra specialists available to us is really beneficial. My really good days here are when I can help people accomplish their goals, really. Oftentimes that's athletes, or sometimes a goal of a kid is just to get out of their cast. I've had the honor of taking care of friends and family members and my friends' kids, and so I'm honored that they trust me with their care. I get a lot of satisfaction about helping patients, especially younger kids, heal from injuries.